Kia ora koutou. I'm not sure if I've been introduced. Sally Stewart, Ministry of Health, currently Acting Manager of the Tobacco Control Team. I've been asked to give an update on the amendment to the smoke-free legislation. Before I do that, I'd just like to step back and outline the current problems we see with the Smoke-Free Environments Act as it applies to vaping. So, as people might know, it's covered by both the Smoke-Free Environments Act and the Medicines Act, but those acts predate vaping and neither of them really work at all well for the regulation of vaping products. So some of the problems we've had is that it's just not clear what's covered and what's not covered. Last year, some of you will be aware that the Ministry lost a court case against Philip Morris. We took them to court for selling their Heaps tobacco stick, which is used with IQOS. The judge found in favour of Philip Morris and made quite a wide-ranging judgment that led us to reverse our view on how we saw vaping products under the Smoke-Free Environments Act. We had previously considered them to be unlawful. The judgment changed that, so pretty much overnight we had to consider them to be lawful and covered by the Smoke-Free Environments Act. But the way the Act is drafted and the definitions mean that we can't enforce any of the provisions for vaping products, so they're effectively unregulated. So that's really the driver behind the work that we've been doing for an amendment to the Act. So late last year, government made some decisions about how it wanted vaping products to be regulated. I'll just outline those. Before I do the detail, the government's taken quite a cautious approach. It's concerned about the potential risks for children and young people, and the decisions that it's taken about how to regulate vaping products largely reflect that perspective. So firstly, all products and all product parts will be brought into the Act. Currently, the Smoke-Free Environments Act covers tobacco products manufactured from tobacco. So this will bring in non-nicotine e-liquids and the devices and components. Vaping products will be regulated largely like tobacco products, so there'll be no sales to under 18s. There'd be a prohibition on vaping in legislated smoke-free areas. There's an exemption there for specialist R18 retailers, which I'll come back to. And just to be clear, that covers our legislated areas, so it's indoor workplaces, early childhood centres, schools, not the outdoor areas that councils have jurisdiction over. There'll also be a prohibition on promotion, advertising and sponsorship, including point of sale display in retail stores. So for the specialist R18 stores, they'll be able to apply to the Ministry of Health to be approved as a specialist store, and that will allow some display of products in the store. Customers will be able to sample, they'll be able to give advice and recommendations to customers, largely carrying out their business as they do now, but with some constraints within store, that is. There'll be some tailoring of the existing provisions in the Act so that they're suitable for vaping products. So, for example, currently tobacco manufacturers have to provide the Ministry with sales data every year. The way that's described doesn't fit vaping products at all, so we'll be making some changes for those. And the government's decisions also include strengthening the legislation where it's currently weak or non-existent for tobacco products. So we'll be able to set product safety requirements, and that will include maximum nicotine levels, prohibiting harmful ingredients, childproof containers, that sort of thing. There'll also be adverse reactions reporting and the ability to recall products for safety concerns. Manufacturers and importers will have to notify products to the Ministry, and we'll hold that on a web-based database before they can sell products. and also that there would be a prohibition on flavours that may attract children. So over the last months, we've been working to develop a government bill that will give effect to those decisions. So in terms of where we're at right now, just to be clear that the government's made decisions, but for the purposes of legislation, these are proposals. Parliament makes the laws. So the bill is currently largely drafted. It's a Smoke-Free Environments Vaping Amendment Bill. It's about ready to go into Parliament. We're just at the stage where we're waiting for the Minister to give us the go-ahead that she's happy with its content. And once that happens, he'll introduce it to Parliament. It will have a first reading speech in the House. It'll be referred to Select Committee, and it'll be the Health Committee. So the Health Select Committee will go through its usual process of hearing submissions on the bill, considering its content, deciding what changes it wants to see to the bill before it reports it back to Parliament. And then it will go through its usual process of further readings in the House before it comes out the other end as a law. Timing-wise, the Minister is making statements still that she's confident about getting it into the House before Christmas. There are only a few sitting weeks left, so I'm not sure if that'll happen, but she believes it will at this stage. So if it does, it's likely to be the new year before the Select Committee is calling for submissions, and all going well, we would hope to see it pass probably the middle of next year. That's pretty much all I've got to say on where we're at and the process. If people are interested in background information, the cabinet papers are on our website. The regulatory impact statement, which is a document that the ministry produces, which accompanies the cabinet paper, is there too. That has our advice in it, and it differs in part from the cabinet paper, which is what the minister has taken forward, and sometimes there's a difference between what we recommend and what she takes forward to cabinet. And there's also a position statement on vaping up there. We'll keep that updated as things start to happen. And I've sent that link to Debbie so she can send it around to everyone. That's pretty much all I wanted to say.